welcome back to our second class for today, which is on social studies, and our topic is going to be on, guess, drugs. Yes, drugs, and we will focus on common drugs. Can you remember our previous lesson on health education? Remember, we learned illness. We learned that illness is a state of feeling sick as a result of infection from germs or insects. And we also learned some common illness. So we want to learn those things, those substances that we need to take in order to cure those illnesses. Okay, that is what we want to look at now. Okay, so we will be looking at what drugs are. Drugs. Yes, what are drugs? Drugs are medical substances which are taken to cure illness. It can be tablets, capsule, or syrup. Okay, take a look at that picture. Does it not look like a tablet? That is a tablet. When you are ill, you take tablets to cure it. Yes. So let's look at what capsule looks like. Yes. So whenever you see this drug, know it is capsule. You don't call the first one you saw capsule, and you don't call this tablet. They are different kinds of drug, okay? The first one is what? Tablet. Why this is what? Capsule. Okay. Yes. This is a syrup. It's a liquid. Yes, it is watery. Okay. Yes. Can you see how freely it flows? Yes. So this is a what? A syrup. Okay, now we want to look at examples of drugs. Yes, this is a paracetamol. What did I say? Paracetamol. Yes, we also have the words. Yes, this is a paracetamol syrup. Okay. This is a paracetamol tablet. Okay. This tablet, the adult uses tablets, when they are ill, when they feel feverish, when they feel weak, they take paracetamol tablet. Okay, while the kids, okay, takes syrup. Okay, they take paracetamol syrup. Okay, yes, let's look at another kind of drugs. Yes, this is what aspirin tablets. Okay, this is what aspirin tablets, okay, is also used to cure illness. Now we want to look at those people who should give drugs to children, those people we should take drugs from. Okay, when we are ill, we shouldn't just go to the fridge or wherever your mommy do keep your drugs and say you want to take drug yourself. Never do that. Okay, and don't just allow anybody around to just give you drugs. Okay, we want to look at those people that need to give, that we can collect drugs from them, those people that we can trust that can give us drugs. Number one is what? A doctor. Okay, number one is what? A doctor. A doctor is a person who prescribe drug for you. Yes, that is what they specialized on. When you are sick, where do you go to? You go to the hospital to meet who? To meet the doctors. The doctors is going to check you, and the doctors will know exactly what is wrong with you, and he or she will know the exact drug to give to you. So whatever drug a doctor gives to you, you should collect it and take it. Yes, that is a female drug. You can see the female drug, treating the girl. Yes. So let's look at another person who we should trust and collect drug from them. Is a pharmacist. Yes. Can you see the woman with a child? What did she do? Yes, she went to a pharmacist to explain what is wrong with her child, and what can you see there? The pharmacist is prescribing a drug for her or giving her drug. Yes, these are the people we can trust. Yes, can you see? I didn't choose the drug life. The drug life chose me, which means that is what is specialized on. You can't come and meet Mrs. Thomas to give you drug. How will I know when you are sick? How will I know what to do to what to give you? Am I a pharmacist? Am I a doctor? Am I a nurse? No. I'm not. I am a teacher. Yes. So another person who should give us drug is a nurse. Okay, yes, nurses give us drug. Yes, they give us drug so we can trust them too. Then who we can trust, when the doctors or the nurse prescribe a drug for us, the person who can give us this drug is our mom. We should never go to wherever the drugs are and take our drugs ourselves. We shouldn't do that, okay, because all these drugs have dosage. Okay, so mom or dad are the people who should give us drug. Can you see daddy giving the child drug? Yes, these are the people we should trust. And another person you can trust is your teacher. When you are strong and you are, you go to school and you need to take your drug during school hour, your mommy won't be there with you. What will she do? She's going to put the drug in your bag and call your teacher and tell her to give you this drug and tell her the dosage, tell her how to give you. Okay, so we can trust our teacher. So yes, lastly is our teachers. So our teachers are the people who should give us drug. Okay, so whenever you are ill, you don't just go and take a drug in the fridge, because these drugs have the specific work they do in the body. Okay, when you are feeling stomach pain, you can't just go and take any drug and say you want to no. There is a drug for stomach pain, there is a drug for headache, there is a drug for fever, there is a drug for body pain. Okay guys, so never take drug yourself. Never ever take drug yourself. Okay, and don't collect drug from strangers only. But you can get drug from doctors with the help of your mom. She'll be the one to take you to the doctor. The doctor will prescribe a drug for you. You can get it, and she's be the one to give you properly. And when your mom is not around, if you have an elderly person who stays with you, she can tell the person how to give you the drug, and the person will give you. So let us be careful. Okay, so here we've come to the end of this topic, and our set work is going to be, don't worry, it's a sample. You're going to mention 5 common drugs you have seen. Yes, we have different kinds of drugs in our home. Yes, so I'm sure you must have seen vitamin C. I'm sure you must have seen paracetamol. I'm sure you must have seen blood tonic. I'm sure you must have seen. So there are so many drugs. So you don't have excuse. You cannot tell me I don't know it. So you are to mention those common drugs that you can see around you, or that you have seen before, or that you have in your house. And number 2 question is that mention 3 persons who should give you drugs when you are ill. So we've come to the end of today's subject. Yes, hope you all enjoyed this teaching. Yes, so to have a nice day. Bye, and I love you so much. Bye.